Good morning all. On this beautiful Sunday morning, we've got a little budgie who's nearly 10 years old, which is a very good age. We normally take the longevity about 10. You can kind of see, but there's been mucus and is swollen on the crop area. So the crop is the first part of the esophagus, which is the first part of the gastrointestinal tract, which is where they store food, and it's filled with mucus. So it's a Sunday morning. This is an emergency presentation. This little girl's name is Tinker. So what I'm going to do is take a tube and push it down into his crop and take a sample out and look at it. But obviously when they get to this kind of age, I start thinking about things like tumors, blockages, obstructions, and obviously if we're lucky, infections. So Tinker's going to get a crop feed now. So we're back with a budgie. So anytime there's something in the crop, we try and put a tube in and we try and take a sample. You can see the mucoid, horrible material that's coming out. So theoretically the crop should contain a bit of seed, but it shouldn't contain so much fluid, and there's much more where this came from. So that's 1 ml of this mucousy infected material, and this is the reason that little Tinker is vomiting. He's vomiting because things aren't passing through. And Tinker, say hello to the video, say hello to our channel, because everyone wants you to get better, so do we. So now I'm going to take this and put it under the microscope. I'll first unstain it, then I might even stain it. And based on that, we'll discuss, just like dogs and cats. We can do x-rays, we can do bloods, and this is a perfect case, possibly do an x-ray and see where the obstruction is. And the basic treatment, as you guys will guess, will be to empty all this unhealthy mucousy soup out and put healthy food in. Mucus like this, it's usually very high protein. That's what's so sticky. And most likely this, because the crop is not sterile, this is going to have a very high bacterial load. It doesn't mean it's a bacterial infection, it just means that the stuff is static. And over time the bacteria just multiply because it's a warm, unhealthy environment, and it'll end up with sepsis in the body. I've looked at the sample under the microscope. It's basically a bacterial filled soup. So it's this unhealthy environment with massive amounts of very unhealthy looking bacteria. And in an older bird, we may not, obviously if there's a blockage later down, it will be difficult to treat, but the short-term treatment is emptying out the crop. We call that crop ravage. We take saline or lactate, which are sterile solutions, and we put it in the crop and wash it out. In the crop, wash it out, so the crop is nice and clean. And then we put in some antibiotics, some antifungals, and a little bit of healthy calories, pre-digested amino acids, so we can start at least getting the bird a bit stronger. But a 10-year-old bird with these kind of things is usually a poor prognosis because we've got age against the bird, and it's most likely something systemic. In this particular case, to try and medicate and see what we can do. So I'm going to try and take a little more fluid out of the crop. We're going to do a barium x-ray tomorrow. We will put some barium into the bird and take x-rays and see if it's passing through. We want to know why there's this big fluid buildup, which part of the gastrointestinal tract is damaged. If any of you have got Budgerigars out there, there's a disease called megabacteria or macrorhabdis. It's a very common budgie disease, and it causes obstruction at the isthmus, which is part of the stomach, between the stomach and the gizzard. And that usually causes an obstruction. So it gets an antifungal called amphotericin, which is the only real good treatment for megabacteria, plus a broad spectrum antibiotic, plus the antifungal stops the buildup of candida, which is a side effect of antibiotics. So let's see if we can get a little bit more out of the crop. Empty the crop. This is now the fourth syringe I'm emptying the crop out, so that we've got 4 mils of mucus. And if you think of a bird who only weighs 46 grams, this is 10% of its body weight. So there's no more, I'm not really getting any mucus out anymore. So I'll put a little bit of warm saline in. We can massage it around a little bit. This is called, I'm putting in and taking out. This is called crop ravage. Where the word comes from, I'm not really sure. There's a vet in Oakley, California who calls it crop ravage, so that's why I'm calling it crop ravage. And His name's actually Brian Spear. He kind of knows me personally, but he's taught me an absolute fortune when I started doing bird veterinary. I used to ask him tons of questions. So I've emptied out the crop. You can actually look in here, it looks like he might have vomited some seed as well.
So keeping birds in a colander again, Phil.
So when the clinic started in about 85, Dr. Pat McWhirter bought this to weigh birds, and it's a brilliant weighing dish because it's got little holes in the side they can breathe, they feel safe and secure. And I haven't been able to find another one, so if anyone's watching this video, if you can give me a replacement colander made of stainless steel or aluminium would be great. So this little guy's going to go into hospital. As you guys know now, antibiotics, antifungals, and we'll give a little bit of barium in the crop feed later today.
What's the barium for?
The barium is a dye. So when you put the barium in, you can then measure time increments, and you can see if it's going through and where the obstruction is, and potentially where the mass is. You might see barium before and after. It's commonly used in humans, and I'm sure a lot of you watching this will have had barium. This is a human. You put this, it makes a strawberry milkshake. You pour this into a cup with warm water, and a human would drink the whole thing, which is 250 mils. But this little guy will get about 1 mil, which is 2% body weight, and that's normally what we work on.